Hello YouTube. In this video, I want to talk about and discuss mental health disparities among African Americans. And part of the reason uh, that this video came about is because I previously did a video about depression, the prevalence of depression among different gender, racial, and ethnic groups. In this video, I really want to concentrate on African Americans. And I was surfing the internet and I ran across this fact sheet published by the American Psychiatric Association. And it was a fact sheet that pertained specifically to African Americans. It's about 4 pages long if you include the citation page, 3 pages if you knock it off. So I just kind of want to read through it and kind of give my thoughts and opinions and just, put the information out there. And then, perhaps we can have, conversations, discussions, debates even about mental health disparities in African Americans. All right. So this is the fact sheet. And first I'm going to start off with some general statistics about African Americans in the United States. Okay. So African Americans make up about 13.3% of the US population. All right. And by the way, this was published in 2017, just an FYI. All right. African American communities across the U.S. are culturally diverse, with immigrants from African nations, the Caribbean, Central America, and other countries. Which is true, those groups would probably be considered at least Black. They may not identify as African American, but they probably would identify as Black, and they probably would be included in the Black/African American category as well. However, oftentimes when I think African American, I think of Black people who were the descendants of enslaved Africans in the United States. I just wanted to put that out there too. All right, next. About 27% of African Americans live below the poverty line compared to about 10.8% of non-Hispanic whites. All right. So when it comes to mental health issues, the amount of money that you make can contribute to that in a way. I mean, not a lack of money can be stressful, of course, definitely, but also money can allow you to have access to resources. If you lack money, then oftentimes you lack access to certain resources that you could use to prevent certain health issues, as well as to deal with and to treat certain health issues. Next, approximately 30% of African American households are headed by a woman with no husband present, compared with about 9% of white households. And I know some people are going to come through in the comments section and be like, well, they're just not married. And I feel like that is part of it, where it's just perhaps they're, she's just not married to the man. But then some people will say, oh, the Black woman kicked out the Black man for a welfare check, right? And then some people will say, oh, well, absentee Black fathers are an issue in the Black community. And then some people will say, well, the CDC's study says that, Black men are the most involved in their children's lives. And of course, you guys know I already did a video clarifying what that study was really about. All right. So, people just going to put out arguments, when it comes to, you know, this this specific fact, but also just in general, right? When it comes to trying to assign blame, responsibility, and accountability, you know how that goes. All right. So next, I want to read some health challenges, and these are just general health challenges that African Americans face. And then after that, we'll get into the mental health disparities. Okay. So approximately 11% of African Americans are not covered by health insurance, compared with about 7% for non-Hispanic whites. All right. So I'm guessing this is after the National Healthcare Act. And also, just because you're insured doesn't mean that you necessarily still have access to, um, mental health resources or mental health treatments, because some people are underinsured. Um, by law, you do have to be insured, but the the law does not specify the specific type of insurance that you need to have. You just need to have health insurance of some sort. So the quality isn't regulated in any way, just an FYI. Next, the death rate for African Americans is higher than whites for heart disease, stroke, cancer, asthma, influenza, and pneumonia. Let's see, diabetes, HIV/AIDS, and homicide. All right. Next, the CDC estimates that African Americans represented more than 1/3, 40% of, 40% or 400,000, sorry, 498,400 persons, of all people living with HIV, and among half, 45% of all persons with newly diagnosed infections in 2015. Okay. So those were some general health issues and health challenges that African Americans face. Now let's get into the mental health status, use of services, and disparities. All right. So rates of mental illness in African Americans are similar to those of the general population. Okay. However, disparities exist in regard to mental health care services. African Americans often receive poor quality of care and lack access to culturally competent care. That is true, because this is probably would be considered a STEM field, and you know Black people are underrepresented when it comes to STEM fields, and especially it's very important to have African American representation, especially in healthcare, right? Especially in situations like these when it comes to mental health, where cultural factors play a role. Next, only 1 in 3 African Americans who need mental health care receives it. Wow. But I could believe, honestly, I feel like that is probably it was higher than I expected it to be, honestly. All right. Next, compared with non-Hispanic whites, African Americans with any mental health illness have lower rates of any mental health service use, including prescriptions, medications, and outpatient services, but higher use of inpatient services. So oftentimes the inpatient service will probably come about when the problem is just too big to handle on the person's own. So, it kind of, you have to see a mental health, or you have to see like some sort of a, mm, doctor, or some sort of a medical professional at some point, because the problem is just too big to handle. You know, kind of like when it comes to, like, say, um, you know, maybe like heart disease or cancer. Like, once it reaches a certain point, then African Americans and just people in general tend to go to the doctor, um, because they can no longer manage it themselves. They probably had a heart attack and had to be rushed to the hospital, or some sort of a medical complication, right? All right. Next, the rate of illicit drug use among African Americans is slightly higher than the national average, 12.4% versus 10.2%. Rate of alcohol use is slightly lower than the national average, 44.2% versus 52.7%. Okay, so African Americans tend to drink a little less. All right. Um, Including heavy drinking, 4.5% to 6.2%, and binge drinking, 21.6% to 23%. Didn't know African Americans were much for binge drinking, but perhaps I'm missing something. All right, next, rate of opioid overdose among African Americans, 6.6%, is less than half of that of non-Hispanic whites, 13.9%. All right, so looks like African Americans aren't fooling too much with the opioids. All right. Let's see. Next, compared with whites, African Americans are less likely to receive guideline consent care, less frequently included in research. That's important because they have to have some type of research to go on usually, like if we want to have mental health treatments that are, customized to African Americans, that are geared to African Americans, then we kind of have to have African Americans included in research. And to be fair, I don't know if that's African Americans opting out, perhaps, understandably so, having, a fear of the medical field due to issues that African Americans have encountered in the past. But also, it could be the institute that is conducting the research. Maybe they just didn't think to include African Americans, or recruit African Americans. That's a possibility too. Next, more likely to use emergency rooms or primary care rather than mental health specialists. So, perhaps going to the wrong person to deal with their mental health issues, the wrong medical professional. And perhaps they may just not know about these medical professionals. Perhaps maybe they don't have access to these medical professionals. You know, it's, a lot of factors that go into that. All right, next. Compared with the general population, African Americans are less likely to be offered either evidence-based medication therapy or psychotherapy. Next, compared with whites with the same symptoms, African Americans are more frequently diagnosed with schizophrenia and less frequently diagnosed with mood disorders. Differences in how African Americans express symptoms of emotional distress may contribute to misdiagnosis. And as well, perhaps people's own prejudice who are making the diagnosis. That plays a factor in this too. But yeah, this is that was a really interesting thing, which may also have some African Americans a little cautious about seeking help because they may feel like they may end up being mistreated or taken advantage of in some way, because they are in a very vulnerable position, right? Like they're dealing with mental health issues and they're trying to seek help. And unfortunately, some people, I would hate to think that doctors would do this, but there are doctors out there that are like that who may hold some prejudice and hold some sort of bigotry towards African Americans. This is why it is important to have African Americans involved in this in some way. Next, physician-patient communication differs for African Americans and whites. One study found that physicians were 23% more verbally dominant and engaged in 33% less patient-centered communication with African American patients than with white patients. So it seems like when it comes to the white people, they're more listening, right? And more engaged. But when it comes to African Americans, it seemed like perhaps they're more speaking to them, probably more, maybe even speaking at them, you know, and they are less engaged. Again, this plays a factor in African Americans seeking, help, for mental health issues as well. Next, Black people with mental health conditions, particularly schizophrenia, bipolar disorders, and other psychosis, are more likely to be incarcerated than people of other races. I can definitely believe that. Oftentimes, when it comes to the court system, I really don't think that the court, like as we all know, I don't really think the court system is like really is fair and balanced at all, really. But especially when it comes to African Americans. And as we know, there's such a long history of dehumanization when it comes to African Americans in this country. And if you're not considered a human, then people probably aren't going to have sympathy and empathy for your mental illness, right? They probably won't even recognize that you have a mental illness, right? As quiet as it's kept, I still think that this, that subhuman propaganda, pseudoscience propaganda that was pushed way back in the day is still low key at play today in society. But yeah, that is terrible. I think that, there should be some sort of mental health treatment if they do know that this person has mental health issues, right? And also, I know some people may try to take advantage of that and be like, pretend like they got mental health issues when they know they don't. But especially if there is some documented evidence of mental health issues prior to this, then definitely, All right. Next, and the last section is barriers to care. So the barriers that African Americans have to overcome in order to receive mental health treatments, right? And to deal with their mental health issues, all right? Despite recent efforts to improve mental health services for African Americans and other minority groups, barriers remain regarding access to and quality of care. The barriers include stigma associated with mental illness. That is true. Mental health, mental health and mental illnesses very much stigmatized. And that's why I do, definitely support when, white people help push the mental health issue, because I know that ultimately it will trickle down to other groups of people. Maybe not as much, maybe not as fast, but ultimately, in the United States, white people are in a position to set the tone. So that's why I definitely support them setting the tone for dealing with mental health issues and leading that charge. Because honestly, if I think African Americans try to lead that charge, I don't think people would even care about it. Let's be honest. I really don't. But if white people do it, then it becomes an issue, right? That's how privilege usually works. Let's be real. Next, distrust of healthcare system. So yeah, African Americans definitely, have a understandable fear of the healthcare system, right? It's like I know my mom, she is definitely she's like on that train, definitely. All right. And based on what she's told me and other folks in our family, that is an understandable fear. But it still is a barrier though, and it still can prevent you from getting uh, the proper health care that you need, just in general, in any situation. That's why oftentimes African Americans tend to have more inpatient health services, because the problem just got too big to where they could no longer handle it themselves, and they had to get some sort of medical intervention, right? Like heart attacks, for instance, or strokes, right? Next, lack of providers from diverse racial/ethnic backgrounds. Yes, that's important too, because once you do get over the other barriers and you do get to this, like mental health professional, you know, will they be able to understand what you specifically as an African American goes through? Would they be empathetic and sympathetic to your specific plight as an African American with mental health issues, right? Because mental health issues are of course stigmatized, but unfortunately, African Americans are oftentimes, generally speaking, stigmatized. So it's kind of like you're still like dealing with the issues of having to go through all the mess that you go through as African Americans, but also having to deal with mental health issues too. So like oftentimes I think Black people don't want to add more stigma to themselves, understandably. And when it comes to the providers and their lack of racial diversity, I think this is why we kind of do need to promote perhaps STEM subjects a bit more, right? Especially when it comes to healthcare, because this is important, to have people who do know where you kind of like are aware of your culture, who know your culture, who are even perhaps even a part of your culture, right? And that can help better facilitate treatment. Next, a lack of culturally competent providers. All right. So, while these providers may not be of your culture, they could still be culturally competent and culturally sensitive to your specific situation as an African American with mental health illness. But oftentimes that's not the case. All right. Next, lack of insurance or underinsurance. Yeah, like again, lack of access to healthcare options, right? Because, like I said earlier in this video, you may be insured, but your insurance may not cover you getting mental health care treatments, you know? And, by law, you are supposed to have health care, that is true, but the quality of it is not regulated within that law. And I think that if it was, I think that would actually cause more problems because some people can't afford, you know, extremely high quality health care. Let's be real. A lot of people can't afford it. Like I said earlier in the video, I read that about 27% of African Americans live below the poverty line. So if you're living below the poverty line, you probably don't have a lot of income that you can allocate to like medical insurance, right? To medical expenses, right? You're just probably trying to pay the rent, keep the lights on, right? Have some food to eat, the necessities. So perhaps maybe mental health could be considered perhaps like a public tax where people pay some type of a small public tax and then allow them to have access to mental health treatments of some sort. But I feel like that's not going to happen either. Um, Even just in general for health, I don't think that's going to happen. But I don't know. Next, other common barriers include the importance of family privacy, lack of knowledge regarding available treatments. That is true. Sometimes people just don't even know. Sometimes they probably don't even know that they have a mental health issue, to be honest. Oh, so and so just crazy. So and so, like, oh, you know how they are, right? But then when it's like, yeah, like so and so really is like crazy, I don't think crazy is the best word to say it to describe it, but so and so really does have mental health issues though, you know. But sometimes you'll probably just laugh it off anyway. Let's see. Let's see. So, lack of knowledge regarding available treatments and denial of mental health problems. Like I said, oh, so and so just, you know how so and so is, right? Also, concerns about stigma, medications, not receiving appropriate information about services, and dehumanizing services have often been reported to hinder African Americans from accessing mental health services. And to be fair, I feel like this is not exclusive to African Americans. I think other groups of people, even white people, probably deal with this, perhaps to a lesser extent, but I still think these are overall perhaps like universal barriers, perhaps, minus like the cultural issues and whatnot. But yeah, that's the end of the fact sheet. So I hope you guys enjoyed this. This video was a bit long. I hope you were able to get something out of this as well. It's just, yeah, it's definitely something to be aware of, right? But thank you for watching. Please feel free to comment and let me know what you guys think. Until the next video, adios and goodbye for now.